its innovation, and its resilience will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 Days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 Days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 Days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 Days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. If the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 Days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, Mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively
Now I've given you everything you need from me, I think. I've given you the green bag. I've given you my voting notes, which hopefully you will never need.
Yes, I think so.
Who did your credentials? Did somebody sign your credentials for you?
Claudia's been doing them. I need to have a word with him just to check everything's sorted and work out what I need to do. I realise this is good for this regional committee. I've been to on my own. He's gone somewhere else.
well.
I hope so. Well, thank you. I completely ignored credentials at every regional committee, so I have no idea what I'm supposed to do.
We among us applied slightly different standards. We try to
Yes.
maintain a.
Well,
Emily, not surprisingly, is
Egg
strict
lace.
as us.
Yes, I mean,
But you, in fact, you accepted credentials from somebody who had no authority to give them in Ripro a couple of years ago. And after that, I decided, well, I'll be strict, but not that strict. That's what it's going to do.
Okay, let's start now. Excellencies, distinguished delegates, welcome back and good afternoon. Let us continue with our business session. The next sub-item is 10.0, process for the nomination and appointment of regional directors. At its 154th session in January 2024, the Executive Board discussed an overview of the framework related to the election of regional directors. After further informal consultations with Member States, the Secretariat presented to the Board at its 157th session in May this year an updated proposal with further measures to enhance transparency, accountability and integrity in the overall process. The Executive Board, via its decision EB 157-9, further invited each regional committee to review its current practices and procedures for the nomination of regional directors and consider incorporation of the measures identified in the report presented to the Board as appropriate to its distinct situation and context. As implementation of some aspects would impact Rule 49 of the Rules of Procedure of the WHO Regional Committee for Southeast Asia, the WHO Legal Council briefed the Member States during a virtual intersessional meeting held on 29 September 2025 on all of the measures highlighted by the Board and what steps the Regional Committee would take should it wish to implement any of them. Excellencies, distinguished delegates, I understand that each region retains its autonomy over the process. I draw your attention to the document SEA/RC 70/13 and open the floor for discussions. Any member states? India?
Thank you, Chair. India takes note of the addendum to draft decision on the process for the nomination appointment of the regional director. We understand that the role of the regional director is pivotal, given the immense scope and influence of this position, and hence it is imperative that the process of nomination and appointment of the regional director be transparent, fair, and conducted with utmost integrity. Chair, India appreciates the emphasis placed on the criteria for the post of the regional director. Strong leadership experience is essential to ensure that the selected regional director brings not only technical excellence, but also the strategic vision, managerial acumen, and collaborative leadership needed to guide the regional office effectively and to deliver meaningful public health outcomes across the region. Chair, As highlighted in the WHO working paper, that members of several regional committees have strongly supported the proposal to formalize live candidates forums and to broadcast candidates' interviews through live streaming during regional committee sessions. India advocated for the formalization of live candidates forums and public broadcasting of interviews at regional committee sessions. These measures will allow member states and stakeholders to gain insight into the candidates' plans, visions, and priorities for the region. This also fosters a culture of openness and accountability that will strengthen the legitimacy of the election process. Chair, India also supports the establishment of a regional evaluation group on a pilot basis, tasked with providing the regional committee with a report assessing the proposed candidates and reviewing the code of conduct. We also appreciate the inclusion of sexual misconduct and other abusive behaviors in the addendum to draft decision on the process for the nomination of the regional director. Chair, India believes that implementing these reforms will strengthen the WHO regional collaboration and ensure that we select the most capable, principled leader to guide our collective public health efforts in the years to come. Thank you.
Thank you. And I can see Sri Lanka.
Thank you, Chair. Sri Lanka appreciates the steps taken to enhance the transparency in the process of nomination of regional director, enabling the suitable candidate being appointed. We note the importance of continuing with the presentation by the candidates and giving the opportunity for discussion. We have some concerns related to the proposed criteria being discussed for Annex C relating to the resolution SCA/RC65/R to be used for assessing candidates for the post of RD, especially relating to the experience needed. We propose 15 years of public health experience reflecting national, regional, and global level experience and engagement. Furthermore, we propose that the opportunity to address across CRE countries and to gain visibility should be provided to all the shortlisted candidates. This can be done through a suitable modality, enabling conveying the suitability and obtaining support of the countries throughout the SIA region. This will provide transparency and hinder power discrepancy, influencing visibility and rallying support. Thank you.
Any delegate of the member country who wish to intervene in this matter? Thank you, delegates. I now invite the WHO Secretariat to respond to the observations made by the distinguished delegates.
Thank you, Chair. I think all the observations as part of the work, the drafting group, specifically Sri Lanka, all of those observations are included in the draft proposed decision. So once I read it, all the points will be there. The same goes also for the observations from India.
Thank you. May I now invite the Secretariat to please read the draft decision. I understand that the drafting group for resolutions and decisions has already discussed and agreed on the proposed draft.
Yes. Thank you, Chair. It's a little bit long, 2-pager, but I will try to be as quick as possible. Proposed draft decision, process for nomination of the regional director. The regional committee, having considered the invitation of executive board at the 157th session contained in the decision EB 157/9 and the annex thereafter, to review the practice of the original committee for the nomination of regional directors and to give consideration to measures to further enhance the transparency, accountability, and integrity of the election process for the regional director. Desiring to further improve the transparency, accountability, and integrity in the process for nomination of the regional director, decides: 1. To amend the desired criteria for assessing candidates for the post of the regional director established in Resolution 0RC 65R1 as set forth in Annex A to this resolution. 2. To establish a candidates forum wherein candidates for the post of the regional director have the opportunity to present their experience and expertise using the modalities set forth in Annex B. 3. To adopt amendments to the Code of Conduct for the nomination of the regional director of Southeast Asia region of the World Health Organization established in Resolution 0RC 70/R3 as contained in Annex C, that the foregoing changes shall become effective upon the closure of the 78th session of the Regional Committee, to establish on a pilot basis for the nomination of the next regional director a regional evaluation group composed of independent experts nominated by each of the member states of Southeast Asia region, parentheses, 1 per member state, parentheses closed, with the understanding that should a member state subsequently nominate a candidate for the post of the regional director, that member state's nominee for the regional evaluation group shall withdraw from the group. 6. That only person acting in their individual capacity and who are demonstrably independent and without any conflict of interest shall be eligible for nomination for the regional evaluation group. Such persons shall not be employed by a national government and shall agree not to seek or accept instruction in regard to performance of their function as a member of the regional evaluation group from any government. 7. That the terms of reference of the regional evaluation group are: A. To interview candidates and assess the written information submitted, including their CVs and written statements, in order to evaluate that experience, qualifications, manifesto, and suitability for the position of the regional director. B. As part of their evaluation of the experience and qualifications of candidates, to oversee the conduct of appropriate due diligence checks. C. To invite the Director General to provide views on the candidates if he/she wishes. D. To report to the Regional Committee on their evaluation of the candidates. To that purpose, the chairperson of the Regional Evaluation Group shall send under confidential cover the evaluation report of the Regional Evaluation Group on all candidates and an unranked shortlist of not more than 3 candidates who, in its opinion, most closely meet by the criteria laid down to the officers of the regional committee, to each member state of the region according to the regional officers list of officials, contact, and to the Director General. And number 8, that an evaluation open to all members of the regional committee will be conducted by the officers of the regional committee within 1 year from the nomination of the next regional director to consider the recommendations of the regional evaluation group regarding any further measures to be taken, as well as to assess the added value of the regional evaluation group, contribution to the process of nomination of the regional director in order to inform a decision by the regional committee on whether to retain the group for any future elections. And of course, all the annexes will be also provided to distinguished delegates. Thank you.
Distinguished delegates, do you have any comment or objection to the draft decision and its annexes? None. Hasinan, with this, the decision is hereby adopted. Thank you. Distinguished delegates, this brings us to the end of this agenda item. We will now take up agenda 11.3, amendments to the rules of procedure of the WHO Regional Committee for Southeast Asia. Excellencies and delegates, to ensure that the rules of procedure of the WHO Regional Committee for Southeast Asia reflect best practices in governance and are aligned where and as appropriate with the rules of procedure of other WHO regional committees as well as WHO global governing bodies, it was proposed to amend the rules of procedure of the WHO Regional Committee for Southeast Asia. A virtual intersessional meeting with member states to discuss the proposed revisions in the RC rules of procedure was convened on 29 September 2025. Redline version of the rules of procedure with a summary table of the update was also presented to member states. The WHO legal team also gave a brief overview on the suggested updates to the rules of procedure. I invite your attention to the working paper submitted by the Secretariat for consideration by the Regional Committee and open the floor for discussions. Yes, I invite the delegates of India.
Thank you, Chair. India take note of the amendments to the rules of procedure of the WHO Regional Committee for Southeast Asia and acknowledges the importance of establishing governance structure that embody best practices and align other WHO regional committees and global governing bodies. India believes that these amendments are crucial for strengthening the overall governance framework of the regional committee. The Government of India appreciates the inclusive and consultative process that has brought us to this point, underscoring the collective commitment of member states to continuous improvement and shared governance. Chair, India welcomes the proposal to amend Rule 2 to align with the WHO framework of engagement with non-state actors, FE and SA. However, the transitional phase requires absolute clarity to prevent the exclusion of valuable partners from our regional work. We also note that a new accreditation procedure in line with FE and SA is under development. The Government of India urges that the formulation of this procedure be prioritized. We recommend that the accreditation criteria be transparent and stringent, designed to prevent any conflict of interest while also taking into consideration national accreditation process for non-state actors. At the same time, the process must give due consideration to national and regional non-state actors whose connect to ground realities and critical experience are invaluable for informed policymaking and effective implementation. By balancing rigor with inclusivity, we can ensure that our engagement with non-state actors strengthens the regional committee's effort to improve health outcomes across Southeast Asia. Chair, the Government of India reaffirms its commitment to advancing public health through strong, transparent, and effective governance. We stand ready to collaborate with all member states to implement these amendments and to continue working together for the health and well-being of the people in our region. Thank you.
Thank you. Any member state to comment on the amendments of the procedure? Distinguished delegates, I now invite the WHO Secretariat to respond to the observation made by the delegation of India.
Thank you, Chair. So the short response from Secretariat. Secretariat note the guidance from member state for us to accelerate the process to accredit non-state actor partners according to the FENSA in due time. Thank you.
Thank you. And I understand that the regional committee also need a decision to adopt these proposed changes. I understand that the drafting group for resolutions and decisions has already discussed and agreed on the proposed draft. May I now invite the Secretariat to please read the draft decision.
Thank you, Chair. Amendments of the Rules of Procedure of WHO Regional Committee for Southeast Asia region. The Regional Committee, having considered the report of the high-level preparatory meeting to the 78th session of the Regional Committee held between 11 and 12 August 2025 in New Delhi, as well as discussions at the virtual intersectional meeting with member states to discuss the proposed revision of the Rule of Procedure in detail, held on 29 September 2025, decided that 1. Amendments to the Rules of Procedure contained in Annex A shall be adopted in accordance with Rule 51 of the Rules of Procedure of the Regional Committee for Southeast Asia. 2. Confirming amendments as shown in Annex B shall be made to the modalities for the presentation process for the nomination of the regional director established in Resolution 0RC 65/R1. 3. The foregoing amendments to the Rule of the Procedure and the modalities for the presentation process for the nomination of the regional director shall become effective upon the closure of the 78th session of the Regional Committee. 4. Pending the adoption of the Regional Committee of an accreditation procedure in accordance with the paragraph 57 of the WHO framework of engagement with non-state actors, only international, regional, and national non-state actors not in official relation with WHO that have already been invited to the Regional Committee sessions may continue to be invited to the future sessions of the Regional Committee pursuant to the Rule 2 of the Rules of Procedures as amended. And number 5, the Secretariat shall renumber the Rules of Procedure of the Regional Committee for Southeast Asia as necessary and at an appropriate time, taking into account the amendments adopted through this decision. All the annexes will be provided to member states as well. Thank you.
Thank you. Distinguished delegates, any comment or objection to the draft decision? None. With this, The decision hereby adopted. Thank you. This brings us to the end of this agenda item. That is agenda item number 11.3. Before moving to the agenda item 14, that is adoption of resolutions and decisions, let's have a tea break, a short tea break for 20 minutes? Now, yes.
15.
So we'll be back in 3:15. Okay. We'll have tea break till 3:15.
Wonderful.
Ready?
Hello, that's the rest of 19 copy.
Excellencies, distinguished delegates, now we are moving to agenda item 14, adoption of resolutions and decisions. We shall now take up the next item, the adoption of resolutions and decisions. I understand that this year we have a total of 10 resolutions and 8 decisions, which is historic. The Regional Committee has already adopted the following 4 decisions titled Decision on the Special Procedures to Regulate the Conduct of the 78th Session of the WHO Regional Committee for Southeast Asia. Number 2, Decision on the Process for the Nomination and Appointment of Regional Directors. Number 3, Decision on the Amendments to the Rules of Procedure of the WHO Regional Committee for Southeast Asia. Number 4, decision on the time and place of future sessions of the Regional Committee. So those decisions we have already adopted. I understand that the draft resolutions have been deliberated and agreed by the drafting group for resolutions and decisions which met during the breaks. The drafting group was convened by Dr. Sridharan, Deputy Director General, Planning, Ministry of Health and Mass Media, Government of the Democratic Social Republic of Sri Lanka, and Mr. Tashi Penjor, Chief Planning Officer, Policy and Planning Division, Ministry of Health, Royal Government of Bhutan, and Ms. Aminath Shaina Abdullah, Deputy Director General, Ministry of Health, Government of the Republic of Maldives, was elected as the rapporteur. We will first take up agenda-wise draft resolutions. I would like to propose that the rapporteur reads only the operative paragraphs of each resolution in the interest of time. I request the rapporteur to read out the operative paragraphs of the first draft resolution.
Thank you, Chair. For agenda item 6.1, Colombo Declaration on Healthy Aging through Strengthened Primary Health Care, adopted by the Ministers of Health of Member States of the WHO Sierra region at the 78th session of the WHO Regional Committee. The Regional Committee, having deliberated upon at length and considered the Colombo Declaration on Healthy Aging through Strengthened Primary Health Care, endorses the Colombo Declaration on Healthy Aging through Strengthened Primary Health Care annexed to this resolution, and requests the Regional Director to report on progress on implementation of the Colombo Declaration at the Regional Committee sessions in 2027, 2029, and with a final report in 2030. Thank you, Chair.
Thank you. Are there any observations? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us take up the next draft resolution.
Agenda 7.2, Program Budget 2026-20 to 2027. Urges Member States to A. Further collaborate with WHO country offices in order to finalize WHO country biennial work plans 2026 to 2027 in line with national priorities while contributing to regional and global priorities. B. Further support resource mobilization to implement high priority areas while further enhancing flexibility in diverting resources to priority areas. And C. Further collaborate with WHO country office on technical work of national and regional importance for improved and optimum utilization of available program budget resources, as well as WHO's social and intellectual capital. And D, strengthen collaborative program management capacities with the objective of improving the efficiency and effectiveness of WHO's program implementation. And number 2, request the regional director to A, ensure efficient management of the regional program budget aligned with priorities as reflected and leveraged by member states in the region and as prioritized by the program budget 2026 to 2027. B, support enhanced partnerships and resource mobilization, especially to countries and programs that have been unable to achieve full funding of their work plans. C, continue efforts in consultation with member states to develop program management, monitoring and evaluation capacities in member states with the objective of improving the efficiency and effectiveness of program implementation, and D, submit regular reports to the Regional Committee on the state of financing and implementation of the program budget based on the results framework of the 14th General Program of including a midterm results report and recommendations therein. Thank you, Chair.
Are there any observations? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us now take up the third draft resolution. The rapporteur to please read out the operative paragraphs of the draft resolution.
Agenda 8.1, Migrant Health, Universal Health Coverage and Health System Strengthening, urges member states to A, integrate migrant-sensitive approaches as appropriate within universal health coverage policies and health system strengthening efforts with aim to ensure equitable access to quality health services without financial hardships for migrants in consultation with relevant stakeholders. B, enhance engagement of migrants in health planning and service delivery. And C, strengthen cross-border and multi-sectoral collaboration to address their specific health needs. Number 2, request the regional director to A, provide high-quality and focused technical support to member states. B, mobilize necessary resources and partnerships. And C, to report biennially to the regional committee with the final report in 2030. Thank you, Chair.
Do you have any observations? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us now take up the fourth draft resolution.
Agenda 8.3, call to action to accelerate actions on antimicrobial resistance in the human health sector in the Southeast Asia region. Number 1, endorses the regional roadmap to accelerate actions on AMR in the Southeast Asia region 2025 to 2030. Number 2, urges member states to A, strengthen national health sector and multi-sectoral collaboration, ownership and oversight of the AMR response at the highest levels of government. B, update their national action plan on AMR and policy strategies in line with the regional roadmap and accelerate implementation of human health sector priorities aligned with core interventions in WHO's people-centered approach by increasing domestic financing to address AMR in national health sector plans and budgets. C, strengthen AMR surveillance and sharing of data through strengthening capacity to diagnose pathogens and expand access to affordable and quality microbiology diagnostics and laboratory services across the health system, including through the WHO Global AMR Diagnostics Initiative. Improving the collection of representative and quality AMR surveillance data, including through implementation of national AMR prevalence surveys. Collecting and timely reporting quality data to GLAS on antimicrobial resistance and antimicrobial use, using data to guide public health decisions and actions, and sharing data across sectors, both in countries and via global data systems. D, enhance education and awareness for behavioral change among healthcare providers and the public to promote the appropriate use of antimicrobials aligned with National Essential Medicine List and standard treatment guidelines. E, maximize joint efforts on AMR with other relevant programs, strategies, and funding, example for immunization, WASH, infection prevention and control, primary health care for universal health coverage, and ensure appropriate use of antimicrobials, including application of the WHO Access, Watch, and Reserve Aware list to support access to diagnostics and healthcare services to patients, and to undertake all the above-mentioned actions in accordance with national context. F, support national regulatory authorities in effectively regulating sales of antimicrobials, strengthening regulation of veterinary antimicrobials, standardizing antimicrobial use data collection, and expanding implementation of antimicrobial stewardship programs. G, promote science, research, and innovation, including research and development, engage civil society and scale up learning capacities and enhancing and experience sharing to accelerate national responses, address inequities, and monitor and report progress. H, monitor AMR National Action Plan implementation, impact of interventions to inform policy decisions, and report annually at the national, regional, and global levels through the Tracking AMR Country Self-Assessment Survey. Number 3, request the regional director to A, continue to provide technical, policy, and implementation support to Southeast Asia countries in their efforts to develop, update, implement, and monitor national action plans on antimicrobial resistance. B, strengthen collaboration with regional quadripartite partners FAO, WOH, and UNEP through the One Health approach, with focus on joint activities at the country level to advance AMR containment and ensure engagement of all partners. C, support resource mobilization, leverage existing multi-sectoral partnerships, and cultivate new strategic collaborations to advance sustained efforts in antimicrobial resistance containment. D, advocate for donors and partners to scale up tailored financial and technical support to countries. And E, report to the 80th Regional Committee in 2027 on the status of progress towards acceleration the fight against antimicrobial resistance in the Southeast Asia region. Thank you, Chair.
Thank you. Are there any observations? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us now take up the fifth draft resolution. The rapporteur to please read out the operative paragraphs of the draft resolution.
Agenda 8.4, Regional Strategic Framework for Combating Smokeless Tobacco, Novel Nicotine Products, and Ericnet in the WHO Southeast Asia region. Number 1, endorses the Regional Strategic Framework for Combating Smokeless Tobacco, Novel Nicotine Products, and Ericnet in the WHO Southeast Asia region, herein referred to as the framework, as a regional roadmap to accelerate action and strengthen national responses. 2, urges member states to A, strengthen the national legislation, regulatory frameworks, and enforcement mechanisms, including comprehensive bans on manufacture, sale, advertising, promotion, and sponsorship of smokeless tobacco, novel nicotine products such as electronic cigarettes and nicotine pouches, and to integrate Ericnet control measures within national tobacco control and NCD strategies. B, enact policies to restrict the availability, marketing, and online sale of novel nicotine products with special attention to youth. C, integrate cessation and counseling services for smokeless tobacco, novel nicotine products, and Ericnet use within primary healthcare and community-based NCD programs, ensuring accessibility and affordability. D, enhance surveillance data disaggregation and research on product use, health impact, and enforcement, including through national and regional observatories. And E, strengthen multi-sectoral coordination involving health, education, finance, customs, trade, law enforcement, youth, and communication sectors to ensure coherent national implementation. 3, request the regional director to A, support member states in adapting and implementing the framework through legislative guidance, technical assistance, and capacity building. B, facilitate the establishment of a comprehensive regional monitoring mechanism with measurable indicators and annual progress tracking, and promote cross-border cooperation on illicit trade, digital marketing, and enforcement. And C, report to the regional committee at its sessions in 2027 and 2030 on progress, achievements, challenges, and emerging evidence to inform midterm and end-of-decade reviews. Thank you, Chair.
Thank you. Are there any observations? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us now take up the next draft resolution.
Agenda 9.4, implementation of the global standards and regional roadmap on health promote in schools in Southeast Asia region. Urges member states to, number 1, prioritize the implementation and institutionalization of comprehensive school health programs and health promote in schools aligned with primary health care and universal health coverage strategies, as well as strengthen PHC to provide essential health services appropriated to age groups of child and adolescent health in schools, along with health advocacy on nutrition, support positive parenting, caregiving, and health literacy to advance health and well-being of staff, parents, and communities. 2, strengthen implementation of the resolution SEA/RC74/R3 and the roadmap for implementation of health promoting schools in the Southeast Asia region. 3, encourage the integration of adolescent responsive interventions into national health and education plans and frameworks, ensuring that these services are tailored to meet the specific and evolving needs of adolescents. 4, strengthen multi-sectoral collaboration at national and subnational levels to create supportive school and community environments that enable children, adolescents, teachers, parents, caregivers, and communities to adopt healthy lifestyles, improve mental well-being, and develop resilience. 5, enhance investment in school health infrastructure, human resources, and digital innovations to improve service delivery and accessibility. 6, support the development and implementation of national policies and guidelines on school health, incorporating NCD prevention, mental health promotion, climate resilience, and digital safety education into school curricula and extracurricular programming. 7, strengthen information and surveillance systems to monitor child and adolescent health trends and outcomes disaggregated by age, gender, geography, and vulnerability status to guide evidence-based policy making and identify school health inequities. 8, encourage relevant stakeholder participation in the design, implementation, and evaluation of health programs, policies, and services to ensure that interventions are relevant, responsive, and respectful of adolescent voices and experiences. Request the Regional Director A to provide technical support and context-specific policy guidance to member states in scaling up the global standards for health promoting schools and inclusive health education for parents, teachers, and communities. B, to facilitate regional and sub-regional cooperation through platforms for sharing best practices, research, and innovations in school health. C, to report on progress on implementation of this resolution, synchronized with progress reports on the resolution SEA/RC74/R3, revitalizing the school health program and health promoting schools in the Southeast Asia region at the regional committee sessions in 2027 and 2029, with a final report at the regional committee session in 2030. Thank you, Chair.
Thank you. Are there any observations? Since there are no comments from the distinguished delegates, I announce the resolution is hereby adopted. I request the rapporteur to please read out the operative paragraphs of the next draft resolution.
Agenda 9.5, bolstering the critical role of civil registration and vital statistics systems in advancing universal health coverage and evidence-based governance. Urges member states to A, strengthen governance and coordination for CRVS through interministerial collaboration involving health, subnational government, and national statistics agencies to ensure unified oversight and accountability. B, enhance digital transformation and interoperability by digitalizing CR process, integrating CRVS with national identification systems, health information platforms, and social protection databases as appropriate to enable real-time data exchange and analytics. C, review and update national legal and policy frameworks to ensure timely, compulsory, and universal registrations of all births and deaths while establishing safeguards for data privacy, sharing, and accountability following data governance protocol. D, invest in human resources, infrastructure, and ICT systems at registration offices and health facilities to strengthen service delivery, data quality, and coverage across all geographic and demographic settings. E, promote public awareness and community participation through targeted communication campaigns, civil engagement, and compliance mechanisms to encourage timely registration and reduce disparities in marginalized areas. F, strengthen national capacity for data use and analysis, enabling routine publication of vital statistics, effective visualization, reporting, and evidence-based decision-making across all development sectors, including health and education. G, enhance proactive role of health sector in CRVS implementation by institutionalizing systematic birth and death notification from health facilities, improving medical certification of cause of death, expanding verbal autopsy in community settings, and enhancing the analytical use of CRVS data for public health planning, disease surveillance, and monitoring of national health goals. 2. Request the Regional Director A to support actions aligning with the Ministerial Declaration tenure extended till 2030 and recommended accelerated actions. B. To facilitate knowledge exchange on best practices, innovations, and digital solutions in CRVS system strengthening with particular focus on integration with the health sector. C. To provide technical support to member states in the implementation of interoperable data standards and data quality assurance tools, and in building domestic capacities to notify and register deaths, record, medically certify, and code causes of death to the standards set out in the International Statistical Classification of Diseases and Related Health Problems, and implement verbal autopsies using standard procedures. D. To coordinate with development partners and international agencies to mobilize sustainable financial and technical resources for CRVS enhancement and digital transformation initiatives. And E. To report progress in implementing this resolution to the regional committee sessions in 2028 and 2031. Thank you, Chair.
Thank you. Are there any observations? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us now take up the next draft resolution.
Agenda 9.7, Emergency Preparedness in WHO Southeast Asia region. Urge all member states to 1. Strengthen multi-sectoral coordination and collaboration for emergency preparedness, response and recovery, ensuring alignment of national efforts with regional and global frameworks. 2. Enhance access to timely emergency medical care through initiatives such as the Emergency Medical Teams Initiative for better management of mass casualty events. 3. Strengthen emergency coordination and response capabilities by further developing upon Health Emergency Operations Network. 4. Encourage member states to prioritize investments in preparedness, resilience, and responsiveness of the health sector to public health emergencies and disasters, integrating these efforts into broader strategies for the attainment of the Sustainable Development Goals 2030. Request the Regional Director to 1. Provide continued technical support to member states in strengthening emergency preparedness capacities, including simulation exercises, training, and resource mobilization. 2. Facilitate cross-country collaboration and knowledge sharing to build collective resilience in the region. 3. Support all member states in the implementation of International Health Regulations 2005 as amended in 2024. And 4. Report progress on the implementation of this resolution to the 80th session of the Regional Committee. Thank you, Chair.
Are there any observations? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us now take up the 9th draft resolution. Rapporteur, please read the operative paragraphs.
Agenda 9.8, Introducing Health Humanities to Health Professional Education and Training in WHO Southeast Asia region. Urges member states to 1. Integrate health humanities in health professional education and training and in health service delivery as appropriate to country context. 2. Encourage innovations and conduct research on the role of health humanities in health professional education and training and in healthcare. 3. Engage in regional and international fora to exchange lessons and positive experiences on producing more compassionate, culturally sensitive, and ethical health professionals, as well as on building a more humanistic, people-centered health system, including the introduction of health humanities in health professional education and training. And request the Regional Director 1 to collect and synthesize evidence and facilitate cross-country exchange on innovative models, positive practices, and outcomes relating to strengthening humanistic and people-centered health systems, including through introduction of health humanities in health professional education and training. 2, to engage with other international organizations in promoting a global initiative to strengthen health humanities to health professional education and training, and 3, to report progress on implementation of this resolution to the WHO Regional Committee for Southeast Asia every 2 years beginning from 2027, synchronized with progress reports on the 2023 resolution SEA/RC76/R3, Delhi Declaration on Strengthening Primary Healthcare as Key Element Towards Achieving Universal Health Coverage. Thank you, Chair.
Thank you. Are there any observations? No? Since there are no comments from the distinguished delegates, the resolution is hereby adopted. Let us now take up resolution titled Resolution of Thanks.
Resolution of thanks. The Regional Committee, having brought its 78th session to a successful conclusion, number 1, thanks His Excellency Dr. Jagat Vikramaratne, Speaker of the Parliament of Sri Lanka, for inaugurating the session and for his inspiring address. 2, thanks the WHO Director General Dr. Tedros Adhanom Ghebreyesus for his thought-provoking address. 3, conveys its gratitude to His Excellency Dr. Nalendra Jayatissa, Minister of Health and Mass Media, Government of the Democratic Socialist Republic of Sri Lanka, and Honorable Chairperson of the 78th session, members of the National Organizing Committee and staff of the Ministry of Health and Mass Media, Government of the Democratic Socialist Republic of Sri Lanka, and other national authorities for their efforts in ensuring the success of the session. 4, expresses its appreciation of and thanks to the 2 Vice Chairpersons, His Excellency Mr. Abdullah Nazim Ibrahim, Minister of Health, Government of Republic of Maldives, and His Excellency Mr. Tanding Wangchuk, Minister of Health, Royal Government of Bhutan, for contributing to the efficient conduct of regional committee sessions. And 5, congratulates Dr. Katharina Boehm, Officer in charge of the WHO Regional Office for Southeast Asia, and her staff for their efforts towards the successful and smooth conduct of the session. Thank you.
Thank you. I believe distinguished delegates have no further observations or comments on this. Let us adopt this resolution of thanks with applause. Let us now take up the decisions one by one. I understand that we have 4 more decisions to consider for adoption. The rapporteur to please read out the next draft resolution. Decision.
Agenda 8.2. Southeast Asia Regional Health Emergency Fund CAF adoption of updated policies and business rules. Decides to, number 1, adopt the updated policies and business rules for CAF 2.0 from the 2026 to 2027 biennium. 2, urges member states to A, consider contributing to and advocating for resource mobilization for sustainability of CAF, including engaging partners and donors. B, guide the working group and the Secretariat in developing a comprehensive resource mobilization strategy for CAF. C, continue active participation in CAF governance, including through the working group, and to further promote transparency and accountability. 3, request the Regional Director to A, implement the CAF 2.0 from the 2026 to 2027 biennium, coordinating with member states as well as 3 levels of the organization. B, develop and operationalize a comprehensive partnership and resource mobilization strategy to ensure sustainability of the fund through wide engagement with member states, partners, and donors. C, continue to support the CAF working group and ensuring transparency and accountability for the utilization of funds efficiently, and report to the Regional Committee aligned with the terms of its resolution SEA/RC77/R2, and report to the Regional Committee annually until 2030. And D, promote harmonization of CAF with global, regional, and other funding mechanisms for health emergencies. Thank you.
Are there any observations? Since there are no comments from the distinguished delegates, the decision is hereby adopted. The rapporteur to please read out the next draft decision.
Agenda 9.1, strengthening climate resilience in health systems in the WHO Southeast Asia region. Decides to, 1, urge member states to A, continue implementing the Male Declaration and regional framework for action in building health system resilient to climate change in accordance with the national context. B, put health at the heart of climate action by utilizing evidence-informed tools tailored to local context to identify and address vulnerabilities, ensuring equitable access to quality health services for all, particularly the most vulnerable populations. C, integrate climate and health data into surveillance and early warning systems, linking them to timely action protocols that reduce disease burdens and address inequities through disaggregated data collection by gender, age, and other relevant factors. D, foster cross-border and cross-sectoral collaboration for knowledge exchange, technology transfer, and innovation. Engage in relevant stakeholders, including civil society, academia, youth, and the private sector to drive accountability and action. Number 2, call upon the United Nations agencies, international organizations, development partners, philanthropic agencies, academic institutions, and civil society organizations to collaborate with member states in developing and implementing joint action plans with clear delineation of responsibilities for each stakeholder group, ensuring strong country ownership and coordination. A, establishment of a robust, coordinated resource mobilization mechanism that integrates domestic and international funding sources, including innovative financing such as climate fund, public-private partnerships, and blended finance to ensure sustainable, predictable, and transparent allocation of human, financial, and technical resources. B, urge all stakeholders to participate in multi-sectoral and multi-level coordination platforms for regular review of progress, sharing of good practices, and joint monitoring and evaluation to maximize impact. 3, request the regional director to A, provide technical support to and strengthen the technical capacity of member states in implementing the above resolutions and actions. B, to convene technical consultations to align the regional action plan and the framework to the global action plan adopted by the 78th World Health Assembly, and for drafting a regional action plan on climate change and health 2027 to 2030. Continuing the implementation of Male Declaration, the framework for action on building health systems resilient to climate change in the WHO Southeast Asia region and the Global Action Plan. And C, to report on progress on implementation of this decision synchronized with progress reports on the decisions SCA/RC75(1), building health system resilience to climate change and extension of the framework for action on building health systems resilient to climate change in the WHO Southeast Asia region, 2017, 2022 till 2027 at the regional committee sessions in 2027 and 2029, with the final report at the regional committee session in 2030. Thank you.
Any observations? Since there are no comments from the distinguished delegates, I announce the decision is hereby adopted. Rapporteur, can you please read out the third draft decision?
Agenda 9.2, extending and expanding regional milestones of the CHARTS, an initiative to reduce CVD burden in WHO Southeast Asia region. The regional committee decides to, 1, to extend the timeline of the 4 regional milestones of CHARTS initiative for another 5 years till 2030. 2, request the regional director to A, convene technical consultations with member states and key stakeholders to develop the proposed extended and expanded regional CHARTS milestones for 2030, encompassing tobacco control, salt reduction, elimination of trans fatty acids, and most urgently, improved detection, treatment, and control of hypertension and diabetes as primary risk factors for cardiovascular diseases. B, support member states in developing national and subnational roadmaps with targets for the implementation of WHO technical packages, HARTS, technical package for CVD, management in primary healthcare, empower measures to reduce tobacco demand under the WHO Framework Convention on Tobacco Control, shake technical package for salt reduction and replace technical package for eliminating industrially produced trans fatty acids, in order to achieve the CHARTS 2030 milestones, with particular emphasis on reducing uncontrolled hypertension through population level and clinical interventions, and C, report the progress, achievements, and challenges on the implementation of this decision to the regional committee sessions in 2026, 2028, and 2030. Thank you.
Thank you. Any observations? Since there are no comments from the distinguished delegates, I announce the decision is hereby adopted. Are you okay? You have to read more. I request Rapporteur to read out the final draft decision for consideration by the regional committee.
9.6, promoting physical activity in the Southeast Asia region, extending the timelines of the resolution SEA/RC69/R4. The regional committee decided to 1. Extend the timeline of the resolution SEA/RC69/R4 for another 5 years, that is until 2030, and 2. Request the regional director to continue A. Support member states in further implementing their national action plans for enabling and promoting physical activity programs based on the 4 pillars of the Global Action Plan on Physical Activity 2018 to 2030, more active people for a healthier world. B. Provide guidance to member states in the development and/or strengthening of the monitoring and evaluation of physical activity and sedentary behaviors. And C. Report the progress, achievements, and challenges on the implementation of this decision to the regional committee sessions in 2027, 2029, and 2030. Thank you, Chair.
Thank you. Any observations for the final draft decision? Since there are no comments from the distinguished delegates, the decision is hereby adopted. Excellencies and distinguished delegates, thank you very much for all the cooperation in facilitating the adoption of the resolutions and decisions. With this, we have finished our deliberations on all agenda items and have come to the conclusion of the session. Excellencies, distinguished delegates, we shall now take up the last item of this meeting, closing of the session. With member states' kind agreement, the special procedures adopted on day 1 has guided the Secretariat to prepare a draft summary report of this regional committee session following the closure of the session. I believe that Secretariat has also taken note of the written inputs posted by the member states and the statements submitted by the non-state actors, intergovernmental organizations, and United Nations specialized agencies, and will suitably incorporate them in the report of the session. The draft summary report will be sent electronically to all members of the region within 10 working days of the closure of the session for their review and comments. Comments or inputs from member states, if any, need to be shared within 15 days of circulation of the draft report. The Secretariat, in consultation with the chair and or the vice chairs of the RC78, will finalize the report, which will be considered to have been validly adopted by the regional committee. Now, I would like to invite the distinguished delegates from our member states to make final statements on their reflections on this session. I request all to please limit your statements to a maximum of 5 minutes. Thank you. From where? All right. We'll start from India.
Thank you, Excellencies, dignitaries, and delegates. As the 78th session of the Regional Committee draws to a close, we would like to emphasize that this session has captured the spirit of change, inspiring renewed determination to innovate, adapt, and advance towards a healthier path. The rich deliberations of the past 3 days have culminated in important decisions that will shape the future of regional health. Excellencies, on behalf of the Indian delegation, I would like to deeply appreciate the government and the people of Sri Lanka for the gracious hosting of the 78th session, the warm hospitality and excellent arrangements. I would also like to join my colleagues in expressing heartfelt thanks to the Director General of WHO, the officer in charge, and the entire WHO team for their tireless efforts in making this session a success. Excellencies, we congratulate all member states and the team, the WHO team, for the unanimous adoption of the Ministerial Declaration on Healthy Aging through strengthened primary health care. Healthy aging is a shared responsibility that requires cross-sectoral collaboration among all relevant stakeholders, including families and communities. To ensure healthy aging for all, policy reforms, improved resource allocation, and community-driven solutions that can change the narrative on aging and prioritize the well-being of older persons are urgently needed. Excellency, we echo this year's World Health Assembly theme, One World for Health, which embodies the collaboration, compassion, and commitment that define our Southeast Asia region. Aligning with this theme, India welcomes all member states to engage in our knowledge programs, fostering mutual learning in public health, digital innovations, and primary healthcare delivery. Excellencies, while this session is ending, our work is only just beginning. We must now translate our deliberations into policies, programs, and actions that deliver tangible results for our people. The Secretariat is required to consider recommendations and suggestions provided by member states to further strengthen health systems and collaborative efforts across the region. We look forward to the 79th session of the WHO Southeast Asia Regional Committee. We wish everyone a safe journey back to their capitals and look forward to meeting again with renewed commitment and fresh momentum. Thank you. Dhanyavad.
Thank you. Next, Bangladesh. Yes.
Honorable Chair, delegates, excellencies, I on behalf of Bangladesh would like to thank Ministry of Health and Mass Media, Sri Lanka, other member states of CRO, Office in charge of the region, WHO Secretariat, senior management for arranging a wonderful 3 days engagement with so many issues of regional interest. Definitely this program and the resolution that has been taken in this session, it will help this region to extend our programs and to supplement the things in our future national programs that will help the almost 1/5 population of the world. With these few comments, I would like to best wishes for 79th session of the CRO. Thank you very much.
Thank you. Then Sri Lanka.
Chair, Excellencies, Honorable Ministers, distinguished delegates and colleagues. On behalf of the Government of Sri Lanka, I would like to extend our heartfelt thanks to all member states for accepting our invitation and for your active participation in making this session a success. We are thankful to the chair of the 78th SEER Regional Committee, the Honorable Minister of Health of Sri Lanka, Health and Mass Media of Sri Lanka, Dr. Nalini Jayatissa, for his exemplary leadership and commitment to health and well-being and for his exceptional role in chairing this session. We are deeply grateful to Dr. Tedros Ghebreyesus, Director General of WHO, and Dr. Katharina Böhme, Officer in charge of WHO Southeast Asia, for their leadership and unwavering support throughout this session. A special thank goes to WHO CRO, the WHO Country Office, and all WHO staff for their exceptional cooperation and support in organizing this meeting. I would also like to express our sincere appreciation to the organizing committee of the Ministry of Health and Mass Media, the officers from Ministry of Foreign Affairs, and the authorities from Public Security, the Ministerial Security Division, as well as the airport and hotel staff whose efforts ensured the smooth functioning of the security and passage of this session. Your collective efforts, coordination, and dedication have made this meeting possible, and we are grateful to you for your unwavering support. We would also like to express our deep appreciation to the delegates for their active and thoughtful deliberations. Your contributions reflect our shared commitment to advancing health in our region, and your continued collaboration will be key as we work towards a collective, healthier future for all. As we move forward together, we remain committed to the shared goal of health for all by all. We look forward to continued collaboration and success in future. Thank you once again, and we wish you all safe travels. Ayubowan.
Thank you. And now I see DPRK. Oh, Nepal, sorry, Nepal.
Thank you so much, Chair, Honorable Chair, Excellencies, and distinguished delegates. On behalf of Government of Nepal, delegation team representing the different sectors, civil society, think tanks, and academia, I extend our sincere appreciations to WHO Regional Office, Director General Dr. Tedros, and Officer in Charge Dr. Katrina, and whole WHO Country Office, and our gracious host, the Government of Sri Lanka and people of Sri Lanka, and for their warm hospitality and excellent organization of RC 78. It has been a pleasure engaging with ministers and head of delegations across the regions, and we are grateful for the recognitions of Nepal received through the regional awards, and found the discussion and side events very insightful and inspiring. We welcome the resolution and decisions which will guide our collective efforts to strengthen our health systems, advance health for all. Nepal remains committed to working closely with WHO and member states to turn these commitments into the concrete results and actions. And Dr. Katrina and your state leaderships has kept the region anchored, placing the country's interest at the center. And your empathy and deep understanding of our context have ensured that history remain agile, focused, and responsive. And we also hope that WHO, the gender participation at all levels will be equal as well. And your powerful metaphor of banyan tree deeply rooted in Asian culture and beautifully capture the spirit of our collaborations. Just as a banyan spreads its branches and draws its strength from its roots, WHO must continue to nurture every country. And your said WHO would be the soil, and we, and as a member states, will strive to keep our soil fertile, and so the banyan trees of the WHO in share continues to grow strong and providing the shade and sustenance for all. At the end, we are very much proud, and we have to say that We are very much privileged and blessed with Global South. That is our Eastern wisdom and knowledge that we have, and spiritualities that we have been practicing, the yoga and various aspects, alternative medicines, and Sri Lanka and India and Nepal. And we are very much proud of having all these Ayurveda and alternative medicines that has a strong implications to our public health, and we would like to strengthen what we have. But we are very, very much privileged of having all those things, and it has a greater significance to our public health and beyond the things that we have been discussing, and still a lot of things that we need to explore, and we have to build on it. Thank you so much.
Thank you. Now the floor to Democratic People's Republic of Korea.
Your Excellency, Dr. Nalinda Jayatissa, Honorable Minister of Health and Mass Media, Government of the Democratic Socialist Republic of Sri Lanka, and Honorable Chairperson of this session, Dr. Katharina Bohme, Officer in charge of the WHO Regional Office. The delegation of DPR Korea would like to extend its deep appreciation and gratitude to the host country, Government of Sri Lanka, and also WHO Senior Management and Secretariat, also our WHO Country Office, for the warm hospitality and the close coordination rendered to our delegation. We look forward to continuous close collaboration and cooperation with our fellow member states and also WHO in the future for the promotion of health and well-being of our people in the region. Thank you very much.
Thank you. And then Thailand.
Oh, thank you, Chair. Chair, Honorable Ministers, Excellencies, distinguished delegates, Thailand joined all member states in expressing heartfelt appreciation to the government of people of the Democratic Socialist Republic of Sri Lanka. Actually, the Chair, Excellency Dr. Nalinda Jayatissa, the Minister of Health and Mass Media, for your hospitality and excellent arrangement throughout this 78th session of the Regional Committee. We extend our sincere thanks to Dr. Tedros, Dr. Katharina Bohme, and the CRO's Secretariat for their steadfast leadership and tireless effort in guiding our discussion and advancing the work of the region in the WHO. These 3 days deliberations have reaffirmed our collective commitment to equity, resilience, and solidarity. The adoption of the Colombo Declaration on Healthy Aging through strengthened primary health care is a milestone reflecting our shared vision for healthier elderly and all people. Thailand commends the spirit of collaboration demonstrated by all member states and the CRO in translating that vision into the practical commitment. We conclude this regional committee meetings. We will turn this aspiration into lasting result for our region, and we love to see the next meeting in Timor-Leste. Thank you, Chair.
Thank you. Then I recognize Timor-Leste.
Thank you, Chair. On behalf of Government of Timor-Leste, especially our Ministry of Health, Her Excellency Dr. Elia Dustreis Amaral, I extend our sincere appreciation to the World Health Organization and also Government of Sri Lanka for warm hospitality and excellent arrangement for this committee session. This week's discussion have strengthened our collective commitment to the health for all and reaffirmed the power of our solidarity. We have shared valuable lessons on health system resilience, disease prevention, universal health coverage, and emergency preparedness. For Timor-Leste, this year marks a proud milestone as we achieve malaria-free certification. This success reflects dedication that we have shared, a valuable lesson on health system. We also welcome to the outcome of this session, including Colombo Declaration on Health. As we moving forward, finally, once again, would like to thanks for government of Sri Lanka for hosting us so graciously and look forward to welcome delegates for the next year. Thank you very much.
Thank you. And now I'll give the floor to Bhutan.
Thank you. On behalf of my delegation, I would like to congratulate all member states for this wonderful 3 days of achievement. It is my earnest desire that we now put into action our 3 days of results. We thank Regional Office and Government of Sri Lanka for this most wonderful and efficient manner in which this RC was organized, and the solidarity of the member states are appreciated as always. Thank you, OIC and the Regional Office team for your hard work. The chairmanship of Sri Lanka is also very much appreciated. We will go back with warm vibes and beautiful memories from Sri Lanka. Thank you for the warm hospitality extended to me and my delegation. As always, Bhutan remains committed to contributing to the regional goals. Thank you, and touch the leg.
Thank you. Any member country to make final remarks? No. Thank you, distinguished delegates. May I now request the officer in charge, Dr. Katrina Bome, to give her closing remarks.
Chair, honorable ministers, dear delegations, partners, and colleagues. We have come to the end of the 78th session of the WHO Regional Committee for Southeast Asia. I wholeheartedly thank you for your insights and inputs, for your participation and partnership, and for your warm words of appreciation. In its 78th year, we have shown that the Regional Committee for Southeast Asia remains the most committed and important forum for advancing the health of nearly a quarter of humanity. Over the past 3 days, we had a schedule that was more compressed than usual, yet, thanks to all your efforts, it's been constructive, effective, and productive. I thank all member states for the Colombo Declaration on Healthy Aging, ensuring we add years to life and life to years, the decision to strengthen the future health leadership of the region through improved transparency, accountability, and integrity, for expanding and enhancing our region's preparedness for health emergencies, readying us for a future of uncertain threats, strengthening the climate resilience of our health systems, preparing us for the most pressing threat of our times, extending and expanding our fight against cardiovascular diseases, and supporting and promoting physical activity across our region, integrating the important needs of migrants within UHC and health system strengthening, accelerating action on AMR to respond to perhaps the most significant public health threat of our generation, and by endorsing the Regional Strategic Framework for combating smokeless tobacco, novel nicotine products, and Areca nut. Even as we focused on the needs of older persons during this RC, you did not forget the young. Your resolution to revitalize the school health program and health promoting schools will protect and promote the health of children across Southeast Asia. I appreciate your resolution to introduce health humanities to health professional education and training, and a resolution on CRVS, which is critical to improving health by providing crucial data for public health planning and ensuring individuals can access health services through legal identity. And last but not least, the amendment of the rules of procedures for the RD election process, establishing a regional independent evaluation group for assessing RD candidates. Across these decisions and resolutions, I have seen time and again a region that is unified in solidarity. It is that unity and solidarity that I also saw on the first evening during all the performances that showed a region so diverse, yet celebrating each other's culture. We have celebrated our successes during the past year and recognized our champions of public health. And in the spirit of celebration, I would like you to join me once again in congratulating Maldives for becoming the first and only country in the world to be validated for the triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B. Nepal for eliminating rubella, and Timor-Leste for malaria elimination. I also congratulate once again our public health champions, the Female Community Health Volunteers Program of Nepal for its transformative role, the Lepra Society for its exceptional contribution in the area of neglected tropical diseases and disability, and Dr. Satendra Singh, Director Professor of Physiology from Delhi, for championing disability inclusion in health systems and medical education. I would then like to thank the hosts and co-hosts of our side events this year, Timor-Leste, India, Nepal, and of course Sri Lanka. In these events, we have been able to learn from your experience and discuss important issues. Speaking of the future, I'm particularly pleased with the launch of our Youth Council. I very much look forward to hearing their voices and views over the years to come. I thank the government and the people of Sri Lanka for your gracious hospitality. The efficiency of all the logistical arrangements was matched by the warmth of your welcome. To all my colleagues in the regional and country office, thank you for your incredible work behind the scenes to make this RC possible and to make it a success. And to our WHO Director General, Dr. Tedros, for his participation and his leadership. My thanks as well to all the wonderful staff and management of this hotel. You have looked after us so well and made us feel at home. I thank you for all your work together to promote, provide, and protect the health of everyone across the length and breadth of Southeast Asia. I would like to wish, last but not least, all delegates a safe journey back home, and our hosts and colleagues in Sri Lanka some well-deserved rest after weeks of preparation and days of a hectic schedule. I thank you.
Thank you, Dr. Katerina. Thank you very much. Are there any announcement from Secretariat before I commence in the closing remarks?
Thank you, Chair. So for tomorrow, we negotiated with the hotel. The checkout for free is until 2 p.m. Then from 2 p.m. until 9, there is a 50% charge. And after 9, then there is 100% charge. Thank you very much, all of you distinguished delegates, for all your participation, and bon voyage.
Thank you. We have now come to the end of the 78th session of the WHO Regional Committee for Southeast Asia. You will agree with me that we have had very useful, in-depth discussions on vital issues related to health development in our region. This regional committee session was certainly very productive. The resolutions and decisions were adopted in an atmosphere of cordiality and cooperation. I would like to thank His Excellency Mr. Abdullah Nazim Ibrahim, Minister of Health, Ministry of Health from the Government of the Republic of Maldives, and His Excellency Mr. Tandin Wangchuk, Minister of Health from the Royal Government of Bhutan, the Vice Chairs of this session, for excellently steering the sessions of the committee and for their cooperation and support. Once again, I would like to thank the distinguished delegates for your active participation. I would like to convey our appreciation to the drafting group for resolutions and decisions. The excellent work done by the co-chair, Dr. Sridharan from Sri Lanka, and Mr. Tashi Penjor from Bhutan, and Ms. Aminath Shaina Abdullah, the rapporteur, supported the adoption of the resolutions and decisions. I also wish to place on record our appreciation to Dr. Tedros Adhanom Ghebreyesus, Director General of World Health Organization, for his vision and guidance. I also take this opportunity to thank the WHO senior management from headquarters and regional office for their valuable contributions to this meeting. I would also like to place on record our collective appreciation and grateful thanks to Dr. Katrina Bome, Officer in charge for WHO Southeast Asia, for effectively guiding the work of the region and paving the way forward. The strong leadership and commitment of the WHO regional management has allowed the region to enhance its policies and technical support to member states and strengthen focus on financing and staffing needs in line with existing priorities. The representative of United Nations, its agencies, other international organizations, non-governmental organizations, and development partners also deserve our appreciation, and I thank them for their contribution to the work of this committee. Let me also acknowledge the WHO Secretariat for their hard work and dedication to make this regional committee session successful. In the end, I do hope the distinguished delegates found their stay in Colombo comfortable and pleasant. I wish you all a safe journey back home. I am sure you will carry fond memories of Sri Lanka and 78th session of the regional committee. With that, I declare the 78th session of the World Health Organization Regional Committee for Southeast Asia closed.